Tuberculosis in Papua New Guinea isn't just an issue, it's an epidemic. More than 1 in 250 people are known to have the killer disease. The real proportion is believed to be much higher. KARI Dusty fell ill 2 years ago, but living in a remote area accessible only by boat, it was 5 months before she was diagnosed. After she had trouble after taking the pills she was prescribed.
I faithfully took my medications, however my body wasn't reacting well towards it. I started to experience some kind of allergic reaction and side effects.
Dusty is persevering, but in rural Papua New Guinea that's unusual. To treat tuberculosis, patients need to take an elaborate and unpleasant cocktail of drugs regularly for months. A lack of clinics and transport to those clinics makes getting those medicines to people or people to the medicines hard.
When the patients miss appointments, when they don't come on their review dates, I trace them. I go out into the village and I meet them and I ask them why you are not coming.
Health workers reach only a fraction of those infected, and when people let their treatments lapse, the disease has a resurgence and becomes more tolerant to drugs. Once it's morphed into what's called multi-drug resistant tuberculosis, the disease is much harder and more expensive to treat. Half of all patients die. Organisations like Doctors Without Borders are trying to help, but there's not enough central coordination.
The frustration that many have here is that Papua New Guinea's government has known for years that it has a big problem and that it's getting worse. And yet, despite having the money, the government hasn't been spending it in the right way and hasn't made tackling tuberculosis enough of a political priority.
Earlier this month, Papua New Guinea hosted the Asia-Pacific Economic Cooperation Summit for world leaders to discuss economic growth. But critics questioned whether a country in the grip of a health crisis should be spending hundreds of millions of dollars on a conference. The government accepts it must do better.
Whilst things like funding for medicines has been there in quite a large number, it's the execution of the health services at the front end that has suffered. And our government, particularly since I've come in as Treasurer, has tried to emphasise that some of the funding streams in our budgetary process are essential for delivery of those services. You can't sacrifice some of those when you're rationing financing.
Few around here have ever been to their country's capital, but it is in Port Moresby that the political impetus is needed to stop what's already an epidemic from becoming a health emergency. Andrew Thomas, Al Jazeera, Port Moresby, Papua New Guinea.